Hello, Dr. Girija here. Today I am going to talk about iron deficiency anemia. About 40% of the Indian population is anemic. Out of that, 80 to 90% is due to iron deficiency anemia. Iron deficiency anemia results from a reduction in the hemoglobin in the RBCs in the blood. Iron is required for the production of hemoglobin. So when there is a reduction of hemoglobin transports oxygen to the different tissues of the body. So when there is a reduction in the hemoglobin, there is lack of oxygen to the tissues, resulting in various symptoms. Fatigue or tiredness, lightheadedness or dizziness, fast heartbeat or palpitation, chest pain, breathlessness, headache, joint pain, mouth ulcers, brittle nail, loss of hair, unusual craving for substances like ice, sand, uncooked rice, etc. Coming to the causes of anemia, the first and foremost cause is a diet which is deficient in iron. Second cause is inadequate absorption of iron from the gastrointestinal tract due to diseases of the gastrointestinal tract or previous gastrointestinal surgeries. Certain foods can interfere with iron absorption like tea, coffee, cocoa, cow's milk, citrus fruits. Certain medications can interfere with iron absorption like some antibiotics, antacids, calcium, vitamin C, multivitamins, etc. Third important cause is bleeding. Bleeding can be internal bleeding or external bleeding. Internal bleeding usually within the gastrointestinal tract due to peptic ulcers, gastric malignancies, or long-term use of certain drugs like NSAIDs, steroids, antiplatelets like aspirin, clopidogrel, etc. External bleeding occurs mainly in women due to excess menstrual blood loss or during childbirth. Then another important cause is worm infestation, especially in children. And pregnancy and lactation also leads to iron deficiency anemia because of increased demand. How iron deficiency anemia is diagnosed? By doing a simple test, complete blood count and peripheral smear. So when you want to confirm the diagnosis, you can even do a serum iron level, serum ferritin level, and total iron binding capacity or transferrin levels. Coming to the normal values of hemoglobin, in newborns it is 17 to 22 milligram per deciliter. From 1 month to 3 years, it is 11 to 15 gram per deciliter, and in children it is 11 to 13 grams per deciliter. Adult males it is 14 to 18 grams per deciliter. Adult females it is 12 to 16 grams per deciliter, and in pregnancy 11 to 16 grams per deciliter. So when the hemoglobin is above 10 grams per deciliter, we call it as, and less than the normal range, we call it as mild anemia. Mild anemia can be treated by taking iron-rich foods like iron fortified cereals are available, iron fortified salt is available, then grains, leafy vegetables, organ meats, then you can take dark chocolates, lentils, beans, and you can take fruits like apple, pears, peaches, figs, and resins, dates, etc. Then oral iron tablets can be taken. It's available as 375 milligram tablets. Only 25% of gets absorbed, and after absorption, in 70 to 80% is used for the production of hemoglobin. 10 to 15% is getting stored in the liver or other organs, and 5% in the muscles or myoglobin. So ideally, iron tablet should be taken in an empty stomach, 1 hour before meals or 2 hours after meals, because I told you food and other medications may interfere with iron absorption. Suppose you are unable to take it in an empty stomach, you can take it after meals, but in that case you have to double the dose of the recommended dose of iron tablets. Suppose you are taking 1 tablet, you have to take 2 tablets. Then if hemoglobin is less than 10 grams per deciliter and above 6 grams per deciliter, then you can treat them with intravenous iron infusions. You can consult your family physicians and take IV infusions. Suppose if the hemoglobin is less than 6 grams per deciliter, then you have to get admitted and blood transfusions. You need blood transfusion, as well as you have to find out the cause of anemia and treat the cause. Then Deworming is a must for all patients with iron deficiency anemia. Don't forget, you can give either 2 or 3 doses of deworming. Thank you.